Good morning, Mrs. Jones. I'm Dr. Mamarian. How do you do?
Nice to meet you.
Nice to meet you, too. I understand you're here because you've been having some chest pain symptoms. Is that correct?
That's right.
Okay. And Dr. Matthew has already seen you, and he's going to describe some of your symptoms to me.
Okay.
So Ms. Jones is a 55-year-old woman here again for evaluation of her chest pain. Over the last month, she's had some intermittent substernal chest pressure, 3 to 4 out of 10, lasting just a few minutes. And it's not really associated with any other symptoms other than shortness of breath that she gets with it. The pain doesn't radiate anywhere. It's not associated with any meals or any other specific activities. And she has no GI symptoms, no nausea, vomiting. But she does.
Okay, excuse me 1 minute, Mrs. Jones. When you get the chest discomfort, do you get it when you're walking and doing things?
Sometimes yes, and sometimes no.
Okay, but you do have some shortness of breath.
Yes.
Okay.
Yes.
Do you ever have any dizziness with the chest discomfort?
No.
No. Okay. And you don't get sweaty or feel ill or nauseated with the chest discomfort?
No. No.
Okay. And it just comes and goes then?
Yeah. I
Okay.
can't understand it.
And lasts a few seconds, a few minutes?
Yeah, no more than a minute.
No more than a minute at a time, and then it's gone?
Yeah.
Okay. All right.
She does have some risk factors for coronary artery disease. She does have hypertension, hyperlipidemia, and does have a history of smoking, although she has quit.
Okay. Have you ever been told you were diabetic?
No.
No. Okay. And do you have a history of heart disease in your family? Mother, father, brothers, sisters?
No. Not
Okay.
that I know of, no.
Okay, great.
Her physical examination today was pertinent for blood pressure 148 over 100. But no other findings. We also have an EKG from the office. It shows some nonspecific ST changes.
Okay. So your blood pressure is a little bit elevated today.
Yeah.
Do you ever take your blood pressure at home?
No.
No, don't have a blood pressure cuff or anything like that? No. Okay, so you're a little bit nervous maybe today in the office.
Probably, yeah.
Yeah, I can appreciate that. So we'll try to get another blood pressure before you leave. Maybe you'll be more relaxed.
Okay. Thank you.
We also have her lipid panel from her primary care office. It shows a total cholesterol of 218 with an LDL of 112.
Okay.
Given her cardiac history and her risk factors, I think maybe we should consider doing a myocardial perfusion scan.
Yes, I would say, in view of listening to the description of your symptoms and the kind of abnormalities you have on your ECG, I think it would be good to do a stress test because we need to know whether you have underlying blockages in your coronary arteries or not.
Okay. What does that mean? What's involved with that?
A stress test?
Yeah.
Well, we would do a myocardial perfusion scan, and what that would entail is for you to go on a treadmill, and I presume you can exercise. You can go on a treadmill and do that, right?
Yeah, sure.
And then at peak exercise, we would inject you with a small amount of a radiotracer, a radioactive substance, to look at blood flow to your heart. And we would put you on, after the exercise is terminated, we would put you maybe an hour later under a camera and take pictures of your heart and look at the blood flow to your heart.
You think that's really necessary? I mean, radiation, I don't like to even get dental x-rays if I can avoid.
No, I understand that, and I understand that you don't want to have any kind of radiation exposure, and we certainly agree with that too. We try to limit the amount of radiation we can give people. But in your situation, because you already have existing abnormalities on your baseline electrocardiogram at rest, it would be very hard to get a diagnostic study just doing a treadmill test alone. In fact, it might lead to a false positive result, which would then lead to other kind of testing, which could even give you more radiation exposure. So I think the myocardial perfusion scan is probably the most appropriate test for you under these conditions.
Okay. All right.
What I will tell you is that we'll try to limit your radiation exposure as much as possible. And what we do in those situations is we'll do a stress study first. And if the stress study is first using a very low dose of radiation, then you won't need the rest study. Okay. And so we'll avoid the higher dose rest study entirely. And that will give you radiation exposure that's less than what you would normally get just walking around the planet in a year.
Okay.
Yeah.
Great.
Has that helped you, and are you agreeable with that plan then?
Oh, yeah, thank you. I think I understand it, and I really appreciate it because I'm so worried about it. So.
My pleasure. And when you have your stress test, I'll be right there to look at the stress results, and hopefully all will be normal and we can stop there.